I want to welcome you all to the 2017 FH Global Summit. It's amazing to look around at this room of incredible brain power and dedication. FH affects every race and every ethnicity. And there are subpopulations within FH who need to be studied more rigorously and require even more specific, specialized care. So we're going to take a deep dive into some of those topics.
Women are not a homogeneous population, and there must be targeted research, as we have just heard relative to FH, on the women with the highest risks and the burdens of disease. What we must do as a group: investigate, educate, advocate, and legislate.
If it wasn't for Dr. Wenger, we wouldn't even be talking about women and heart disease today, because we would probably still think it's a man's disease. But as she outlined today, it's the #1 killer of women and the #1 killer of men.
This is a powerful summit, and it's a great example of what we should all ascribe to in medicine. These summits are how we can move the bar and try to make a difference.
This incredible complex interaction between genetics and environment is not entirely solved. My colleagues and friends in Amsterdam still see patients that have an absolute FH phenotype and they can't find anything. There must be more to discover.
As a physician and a scientist, I think it's a slam dunk. I think that everyone should have genetic testing. And unfortunately, we don't live in a vacuum, and I think there are a number of other considerations that are important.
Well, work by our group showed that the best age to screen for FH is actually in childhood, after the first year of life. I would argue that the child benefits twice. Firstly, by being identified early, that child can develop good lifestyle habits and start treatment before the onset of disease. But also, they benefit by avoiding the premature death of their parent.
I often use this illusion that the Cascade FH, which is the name of our registry, is the foundation of the foundation's work. We knew at the beginning that data drives policy changes, and you can't know what to do until you have examined where you are.
I think the FH Foundation has done a fantastic job in highlighting interesting, compelling scientific questions that funding agencies should be able to support. The challenge is taking that knowledge and turning it into practice for the benefit of everyone who is eligible. We need to go beyond just a research discovery and also think of how we engage strategic partners to do the education, to do the communication. We must act, and we must find ways to translate what we know into real impact.